Hi everyone, this is Dr. Benson Evans here talking with you. It is February the 11th and it's a beautiful day here in Southern California, except it's a little chilly with a wind that we have coming in. Anyhow, on topic, I want to talk with you about gaslighting. Um, in today's society that is changing rapidly, we have a very poor delivery of medical care. The American medical system is just a complete problem, and for many, it's an enigma as to how to get through it the best. What I want to talk about is the topic of making sure that we are diagnosed when we need a diagnosis. And many of us go to the doctor and we have complaints, and the doctor says, oh, it's all in your head, or it's age related, or it's allergy, or it's any other problem that we may think it is. And so I want to point out, when we go to the doctor, if the doctor doesn't hit the nail on the head and do extensive testing for what you think you might have, then you need to stand your ground. Stand your ground means to insist on the doctor taking your symptoms to the nth degree, evaluating them, and making the proper diagnosis and prognosis. When I had my diagnosis of stage 4 non-Hodgkin's lymphoma, I was diagnosed and given 4 to 6 weeks of life if I didn't have chemo immediately. Now, why did I let it get to that stage? It was because of the gaslighting and incompetency of the doctor that I had. I was told that the symptoms that I had, which were fatigue, chronic sinus infections, pains in my fingers, swollen glands, I was told that all of them were probably related to allergy. And it wasn't until I started to question it more that I knew something wasn't right, but I didn't know where to go until I wound up in the emergency room because I had chest pain and such weakness that I couldn't walk. And when the emergency room doctor asked me what I thought was wrong, I said, I've gone to many doctors, and you know what? I get nowhere except thinking maybe I have cancer. And an hour later, after a CAT scan, I was told that I had cancer. And it wound up that it was all over. Moral of the story is, when you go to the doctor with specific complaints, make sure that you get a complete evaluation that you are satisfied with. Do a little research, whether it's Google or any of the other medical sites, and learn a little bit about what your symptoms might mean and bring them to the doctor's attention. I had this issue when I had a heart issue going on, and the PA in my doctor's office said, well, I don't know why you're having such a problem breathing and why you feel that your abdomen is swollen. And I said, let's look at the test results. And I saw a diagnosis in there that said diastolic function stage 2, which is a problem with the heart. And I said to her, did you see this? And she said, oh, well, in that case, let's put you on a diuretic. And I was placed on a diuretic and a medication for my heart, and the symptoms have disappeared. Moral of the story, again, is take a look at your test results. My advice is to get a copy of your test results every time you get a test. And after you have a visit with your doctor, if you are in one of the programs such as my chart, take a look at what the after summary says and make sure you agree with it. So let's refuse to be gaslighted. Again, with the way the government is going these days, with the insurances going the way they are going, we have to look after ourselves and insist that we get the care that we are due. My suggestion is be strong, insist on good care, insist on the fact that you are due an evaluation that is competent, and be well. Have a great day. Bye.